Hi and welcome to Grey Matter. Today we are going to discuss about the difference between central serous retinopathy and cystoid macular edema. So we are going to discuss this in a tabular form. And first central serous retinopathy, which I will be saying as CSR, the pathology is at the subretinal level. So this is the neurosensory retina, the 9 layers. Then we have the subretinal space, then the RPE, then the Bruch membrane, and then the choroidal sclera. So the pathology is at the subretinal level. Apart from that, the risk factors for CSR are: the major risk factor is steroids, hence excess of glucocorticoids is as seen in Cushing syndrome, pregnancy, type A personality, which is mediated due to the increase in stress of the patient, then H. pylori infections. Now when you see the FFA finding, which is fundus fluorescein imaging findings, we see that the first finding which is there, this is an ink blot appearance, and the second finding which is there, which as you can see appears like a smoke stack. So this is a smoke stack appearance and ink blot appearance seen on FFA in CSR. Now you can see on OCT, which is ocular coherence tomography, we have these findings. You can see that the finding which is here is the break in the membrane at the RPE and the Bruch membrane, and you can see the bulge out of the neurosensitive retinas. Apart from that, as you know that the major risk factor of CSR is steroids. So first, if the patient is on steroids and it is precipitating, we'll have to stop steroids, and usually CSR is self-resolving after stoppage of steroids and removing the risk factors. But if it's still persistent after 4 months, then we'll have to do photodynamic therapy or laser photocoagulation, of which photodynamic therapy is preferred. Now we are going to discuss about cystoid macular edema. So cystoid macular edema, as the name suggests, that there are going to be cysts in the macula due to the edema, and the pathology is at the level of outer plexiform layer of retina, and the risk factors or the causes are remembered by the mnemonic run for pride. So for R, we have retinitis pigmentosa, U, uveitis, N for niacin, which is B3, then P for prostaglandin E2 analogs, R for retinal vein occlusion, I for Irwin-Gass syndrome. So this is basically your post cataract surgery cystoid macular edema. And then we have diabetic retinopathy, and in patients, aphakic patients, on application of epinephrine. So similarly, when we see the FFA pattern in your cystoid macular edema, you will see this typical flower petal appearance. Okay, so flower petal appearance seen in cystoid macular edema. Next part, as you can see on the OCT, you see that there are cystic spaces, okay, in the retina, and also we know that the outer plexiform layer is at fault. So you will see that the RPE, Bruch membrane, everything is normal. So there are cysts on OCT in cystoid macular edema, and as we know that all the risk factors which are there, and apart from that, most of the risk factors are inflammatory and infectious or post surgery, the first line treatment for CME is your steroids. Okay, so this was all about your difference between cystoid macular edema and central serous retinopathy. Now at the end of the presentation or the video, we have question of the day. So question of the day is: identify the test or the procedure being performed and use of the test. Okay, thank you. And if you have any comments regarding, or you have any special request or suggestions regarding the videos which you want, please comment, please give your comments, and we'll make sure that our subsequent videos will be on those topics. Thank you.